Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, basically, brain uses electric signal to think, to feel, and to any activity, like the electricity, which has positive and negative. Our body also is like body positive and negative. If something abnormal happens
Yeah.
over there, there will be abnormal amount of electricity, which causes seizure. Is also said like storm of brain, where there is a abnormal stimulus during which people can feel unconscious, shaking, convulsion like shaking like this one. So you won't feel panic.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Epilepsy. Um, Epilepsy is usually a medical term we usually use for a seizure. If the person has more than two times of convulsion, which is unprovoked without any causes, that is called a seizure, which should be excluded. Fever, infection, this is the main cause. This can cause a main type of seizure, which is I will describe you later. It will be simple, partial, complex seizure.
What are the different types of seizures and do they affect people differently?
There's a many type of seizure. There's a we have about company like we have classification of seizure where we only describe one or two types of seizure. One is generalized seizure, one is focal seizure. Generalized seizure means when the patient becomes fully unconscious. He have severe seizure, tonic headache, even tongue tie, urinary micturition, even incontinence of stool. Partial seizure means like even a flicking of movement is a partial seizure. Only movement of one hand is a partial seizure. Or like action seizure, like you are watching in the blink of the eye, you have no hair, and suddenly you come back, and this is called absence seizure. So generally we divide general seizure and focal seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So basically 50% of people doesn't have the actual cause. It's called idiopathic seizure. But after 50% people could have due to the head injury, brain infection, sometimes tumor causes seizure. In the older age, could be due to the stroke, is Alzheimer's disease. There has been reported that seizure could be due to the genetic cause, but still research is being on.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Symptom of seizure usually is sudden onset convulsion. This convulsion is involuntary movement, sudden stiffness, abnormal jogging movement, clearing of eye, uprolling of eye, or loss of consciousness, or staring simple same place, or confusion, confusion, or involuntary movement of single part of body would be the symptom of seizure.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, unfortunately, seizure patient people think seizure or convulsion epilepsy is a transmissible disease. It's not, which from the last period of decades, this said give avoid the seizure people, but it's not so. It's not transferable. It's not communicable. Even if you take it from that patient, it's not transferable. So due to that, people used to avoid seizure people in a society. I even used to say, today only I said to my patient, it's not communicable. Just now, before half an hour ago, I have a lady called 15 years old lady who has seizure because she has a fever and everyone is scared. They're thinking it's being spreadable. It's not. It's not communicable, but it can lead to society discrimination. But it's treatable.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Stigma is there. Still, the discrimination between the epileptic patient and non-epileptic patient, even for the job or to get married, even they avoid playing with the kids. This is all like stigma, like that is communicable, like communicable. So we should educate the people, society, lot of social workers here, not like social stigma is spreadable. We have to socially accept this. Because medicine can prevent seizure. Seizure.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So the seizure is due to the disbalance of electrical signals in the brain. So we should avoid anything which stimulates our brain. So we have to have a habit like adequate sleep, normal diet, no late night, avoidance of like, alcohol consumption or any stress. We on for future patient, we should avoid high risk activity or sport like swimming, high altitude traveling. We should avoid. There is also a program, but physical and relaxation program, even counseling, and even social support group still where you can go for that.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Like seizure can happen anytime. Nobody knows when it will happen. If you stay at home, always avoid dodgy teachers or watches can tangle over. You have to avoid people now start to comment. Even if you know in the kitchen, you're doing a kitchen walk, use one breakable idea. If the breakable use double or don't avoid the fire, stoves. If you cooking your shell, cooking your shell, use the micro not stove. Best things to do. Use your sharp edges. Cover it with a soft thing. Even in a room, carpet, soft carpet. All what is called head to. If you go outside, speak with your friend. Don't go alone. Seizure can happen anytime. This is advice.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Okay, look, the myth and social stigma is always with the epilepsy. If you even have a friend have epilepsy, you always discriminate. Love, affection, support, the treatment of this epilepsy. I want to make sure in the end, epilepsy is not communicable disease. The 50% of people with epilepsy which has no cause of any harm. Like so the 50% have other causes like tumor, bleeding, cirrhosis, something else. This can be treatable. But 50% of them doesn't have any cause. So discrimination is not treatment. We have epilepsy patient, high blood pressure who has been treated all India still see an epilepsy. Now, last 5 years, since with me, she doesn't have a single action of treatment. So, because medicine, medication or treatment is not communicable, only love, support, care, and medicine is needed. If it lasts, there's always a treatment, which is surgery. That's what is still there. Epilepsy surgery is done in India. Thank you very much.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.